It gives me great pleasure now to move on to presenting some of the awards bestowed by the Committee for Scientific Affairs and Awards. And the first one of these is the ESPID PIDJ Award. The ESPID PIDJ Award is made annually for the best paper published in the Pediatric Infectious Disease Journal by an ESPID member. This year's award goes to Dr. Arantxa Sanchez for her paper entitled Mortality in Perinatally HIV-Infected Adolescents After Transition to Adult Care in Spain. And we're very lucky to have the Editor-in-Chief, Steve Black, to present the certificate.
Thank you. Congratulations.
So good morning, everybody. My name is Arantxa Berzosa, and as they say, first of all, I would like to thank the committee for choosing this article for the award, which is called Mortality in Perinatally HIV-Infected Adolescents After Transition to Adult Care in Spain. Of course, I have to thank all of my colleagues who worked with me in this project, and in special, I have to thank Dr. Ramos and Dr. Navarro, who trusted me to carry on this study. So, as everybody knows, mortality in HIV patients decreased after the introduction of antiretroviral treatment, but still we have patients at risk. So the aim of our study was to characterize the mortality and comorbidities of patients perinatally HIV-infected who transferred to adult care. We performed a retrospective multicenter study within the patients that conform the Spanish national cohort of pediatric HIV patients, and those who were transferred to adult care, and we include all patients who died between 2000 and now 2019. Trying to summarize the results, there are 1,300 patients that were followed in CORISPEC network, and among them, half of them were transferred to adult care nowadays. Among 400 patients, we know that there have been 14 deaths, which means 3.5% of patients. All of the patients that they were Spanish, and most of them were women. As you can see here, the characteristic of patients during pediatric care and adult care, they were diagnosed at a median age of 1 year old. The immunovirological situation was not so good during pediatric care. You can see that 6 of the patients were classified at CDC clinical stage, and the proportion of time that they were undetectable when receiving antiretroviral treatment was only 30% during the pediatric care, even less during the adult care. We know that 12 out of 14 patients stopped treatment at least 2 or more times during this follow-up, and the median age of death were 25 years old. Trying to describe the death cause, all of them were related to advanced HIV disease. Half of the patients have mental health disorder, and the main comorbidities that we found were recurrent bacterial infection, Westin syndrome, esophageal candida, and pneumocystis jirovecii pneumonia. Fortunately, 4 women have 11 pregnancies. There were 5 newborn, and none were infected. And if we compare the mortality rates of our cohort with the mortality rates in Spain, we see that all of the rates were higher in our cohort. So just to conclude, young adults perinatally HIV-infected who transition to adult care without virological control or who has no adherence to antiretroviral treatment are at high risk of mortality, and mortality was noted as a consequence of advanced HIV disease, mental health disorder, and poor adherence to the treatment. So thank you very much, and Sparisto.